Clarify that when we advised you on Tuesday, February the 23rd, that we had detected errors, we did inform the public and the media that one of the ways that we had identified that was through an acutely ill patient in St. John's in hospital. At that time, we did not disclose any further information about the patient, and we did that deliberately. But it wasn't done to downplay the issue. It really was done at the family's request. They asked us not to provide any specific details on this patient's condition, and they continue to ask us that. As late as last evening, they confirmed that they do not wish us to speak to specifics about this patient. We respected that request. Our patients and their families have a right to privacy, and in fact, that privacy and confidentiality continue to be one of the principles under which we provide care to our patient continues to be critically ill. I did offer to speak to the family to discuss their concerns. Understandably, their immediate focus is on the condition of their patient, of their son, and I certainly respect that. When the time is right for them, if they want to discuss concerns with me, I will be available.
First, let me say to you that my major concern is for the patients who are affected by this cyclosporin testing, and certainly for the patient and his family who have come to our attention in the last few days. There's no question that this is a serious situation, but I have to comment in relation to any attempt to downplay the seriousness of the errors made in the biochemistry lab. First and foremost, we did not reveal any details of the particular situation because it was my understanding last week when I spoke to you, and it's still my understanding today, that the family does not want us to talk about the details of the individual involved. In the news release last week, there was reference to an acutely ill patient. I indicated at that time, and I reiterate today, that what's happened in the lab is totally unacceptable. That the errors made will be examined in the next period of time, and to that extent, as Ms. Kamensky indicated today, the University Health Network from Toronto will be coming to the province next week, and will conduct a full review of the biochemistry lab, and will also then review the other labs, including pathology. Ms. Jones was talking about yesterday.
I wasn't at the news conference. However, I did hear other reporters who were there and who have listened to the audio, the tapes of that conference since, say that they did ask that Dr. Parfrey answered that no one was seriously ill, but Ms. Kamensky said today he was talking about his renal patient. She was sitting right next to him when he answered that. Why? She did.
Again, I don't know what was said, but my understanding was clear last week and remains the same today, that there are essentially two groups of patients out of the 234 patients. There are the patients who are in renal dialysis, will be treated with that, and that Dr. Parfrey dealt with that. Then we have the other group of people who are organ transplant patients or other immunosuppressed. It was my clear understanding, because I can tell you, I remember clearly getting a phone call at, I was actually in Toronto at the time, at approximately 5:30, indicating that the situation, as to what the situation was, and right away I was aware of that there was an individual who was critically indicated, asking, how does the family want us to deal with this? I understand the anger. I mean, anyone who puts themselves in that situation that they find themselves in are angry, and I understand their anger. But all I can tell you is that there was certainly no intention on my part to downplay the issue. That my understanding was, and I was briefed. I came back from Toronto to deal with the situation on Tuesday. I met with the health officials on Tuesday night, approximately 8 o'clock here, and then Wednesday morning I went before Mike's, and it was my understanding that had been passed on to me the night before that the family wanted their right to privacy respected. And it's strange, it may seem strange to some, but it's my understanding again today that they still don't want us talking about the private situation.